Camera's off.
Hi, can anyone hear me?
You good?
Welcome everybody to the annual general meeting of South West London and St George's Mental Health Trust. Thank you all so much for joining us today. Can I first ask you, there's a lot of people joining us, so can I ask that everybody turns their camera off and they make sure that they mute themselves, and that'll just mean that we can manage this meeting in a more comprehensive way. Firstly, I'd like to introduce myself. So my name's Jenna Calfan and I'm the Director of Communications and Engagement at South West London and St George's. Before I hand over to Anne, our chair, I just want to go through a couple of housekeeping points. As I said earlier, we've got an awful lot of people joining us, which is absolutely brilliant, but it'd be great if you could just keep your cameras off and your microphones on mute as we go through the meeting. If you've got questions, please ask them as we go in the chat function. There will be 2 Q&A sessions where we will have the opportunity to answer your questions. We'll endeavour to get through as many questions as we can in the time that we've got, but if we don't get around to answering your question, we'll follow up with a full Q&A, which will be sent to all attendees after the meeting. We'll also share a link to the PowerPoint and a recording of the session. And at this point, I'll remind you all that we are recording this session and just to make sure that you're content with that. So the meeting is jam-packed. There are no scheduled breaks, but I want you to know that you can feel free to take a break whenever you feel like you can. There are a couple of videos that are going to play in question and answer sessions that'll mean that you can you should be able to take breaks as you go. We've already let attendees know, but we've got a BSL interpreter throughout the event to make sure that it's as accessible as we possibly can be. We've posted in the chat a link to a Zoom link where BSL interpreters will be available for anyone who requires them. Also, if you've downloaded a Microsoft Teams app, you will be able to have live subtitles. You can turn them on using the three dots, which will give you a range of options. In terms of our agenda, we'll be first hearing from Vanessa Ford, our Chief Executive, who'll give you some of the highlights of our year. Philip Murray, our Finance Director, Sharon Spain, our Director of Nursing, and Billy Boland, our Medical Director, will also offer short updates. The second part of the meeting will focus on our place in the community, and we'll have a number of external speakers joining us. But before then, I'm going to hand over to Anne Beasley, our Chief Executive, to give you a formal welcome to the meeting. Thank you very much.
I'm actually the chair, but thank you, Jenna, and welcome everybody to our annual public meeting. And thank you for making time to be with us tonight, either online or at our screening at Springfield. As it says I was muted. I don't know how much of that you heard, but I'm Anne Beasley. Let me get this right. I'm Chair of South West London and St George's Mental Health Trust, and I will be hosting this evening. When I spoke to you this time last year, we were facing a lot of uncertainty about the future. Anxiety was very high, and the NHS was dealing with one of the most difficult periods in our 73-year history. We don't underestimate the challenges that remain, but I'm glad that 12 months on, we seem to be coming tentatively out of the worst of the pandemic. Tonight, we will be looking back at our year's work, but also looking ahead as we come together out of COVID. Before we do that, however, I want to take a moment to reflect on the impacts that this has had across our communities, the loved ones that many of us have lost, the struggles and the hardships that many of us have faced, the inequalities that have deepened, and the structural racism that has been more starkly exposed. The impact that this has had on our mental health and well-being is hard to put into words, and it's clear that we will feel this for some time to come. The world has changed in ways that we could scarcely imagine a few years ago, and we know that there is much work for organisations like ours to do to support our communities. But despite the challenges, it's a time of investment and innovation here at South West London and St George's. And I hope you will see tonight some of the work happening to ensure a thriving future for mental health services in our part of London. As an NHS trust, we add so much to our local communities beyond the services that we provide in supporting our local economy, in supporting local employment, in supporting local businesses. And as an anchor institution, we are committed to supporting our local recovery. That's why, as well as hearing tonight from our team on the highlights from our annual reports, I'm delighted, as Jenna said, that we will be joined by special guests who will be talking to us on the theme of our place in the community. And we look forward to inviting later Dr. Bola Owolabi, Director of Health Inequalities at NHS England, Michael Wood, Head of Health Economic Partnerships at the NHS Confederation, and a number of our friends and colleagues from Citizens UK, who we've been working with over the last year. We've got a packed agenda for you this evening. I hope you'll think it's an exciting agenda, and I will shortly hand you over to Vanessa, our Chief Executive, to take us through some of the highlights. But before we do that, we're going to play a short video where one of our patients, Lee, shares his recovery journey. Lee came and talked to us at the board a few months ago, and I know that you will find him really inspirational.
I've been in recovery from a serious mental health issue for the last couple of years, and that's given me many opportunities and many possibilities that I find really, really empowering and help my life. It's really improved my relationship with my family and my carers. I've got a really close bond with people close to me, and I've got some really strong friendships, and all those have come about since I found recovery. Recovery was made possible to me by many avenues. I have a mental health support worker through the primary care network system, and he knows me very well and has been working with me for the last 4 years and has helped me really understand my mental health and let me lead the way through to recovery. I also use the Recovery College up at Springfield, and that's a massive tool and a massive opportunity to really understand what's going on in your life, how you're feeling, how you can manage it, how you can build your toolkit and really sustain a good and meaningful recovery.
So hearing Lee talk is the very reason why I get up and come to work in the morning. My name's Vanessa Ford and I'm the Chief Exec for the Trust, and I'm absolutely proud and privileged to be in this position. South West London and South West London and St George's has been part of my life for the last 25 years, and it is the only reason I come to work is to improve things for the mental health community of South West London in an inclusive way. So I'm going to take you unashamedly through some of our key highlights of this year. We have one very clear mission. Our mission is to make life better together for our people, our patients, our staff and our communities. We're going to do this through our future integrated program. We have 4 key strategic ambitions that support our delivery around increasing quality years, reducing inequalities, making the Trust a great place to work and ensuring sustainability. And all of this is made possible by the way in which we lead our Trust in terms of our values. Our values were created by over 700 of people with lived experience and our staff. And it's those values that have held us in good stead throughout the last year and through our response to the pandemic. So we serve a stonking 1.2 million people across the 5 boroughs, and we employ just over 2,300 staff. And this year we've seen a great improvement in the number of volunteers and the use of our involvement team, so people with lived experience. 73% of our staff are frontline workers, and that's impressive. It means that the bulk of our staff are in there involved in frontline care, but actually every member of staff has that commitment to our patients and to the work that we do. We made over 420,000 contacts last year, and an astonishing 1,168 per day, including weekends and holidays. And I'm delighted that 84% of our patients would recommend our Trust as a place to receive treatment, but that's still not good enough for me. I want people to be happy with their care of treatment 100% of the time, that it's good enough for myself, for my partner, for my family, for anybody that we know. In terms of responding to COVID, 100% of our services ran throughout the pandemic, and we really pulled together across the integrated care system to ensure that we were doing the very best we can for the mental health population. We know that people with mental health conditions were disproportionately impacted due to the pandemic, and we continue to see people face to face throughout. And that was really important because often we were the only people. But I also want to give a really big shout out to the third and voluntary sector services. Without their support, we could not have continued to do what we have done. So thank you for that. So what did we do to maintain our services? How did we transform them? So we have always been working to ensure care closer to home. We've done that through accelerated discharges, reducing avoidable admissions and enhancing crisis care. Also, with our colleagues in the South London Partnership, so colleagues from SLAM and Oxleys, we formed 3 of the 10 national provider collaboratives, which led to a devolved budget of over £400 million, which has led to 66% reduction in forensic readmissions and 93 fewer children and young people requiring treatment out of there. 93% of children and young people haven't been placed out of area. That's what I'm trying to say. We offered extended hours for our services, and we've offered a blended face-to-face. So you can see there 50% of our contacts were by telephone, 25% virtually, 25% face-to-face. Really improved the way in which agile working in a blended model can work. We also supported our acute sector colleagues and our patients by setting up a mental health A&E, which we fondly refer to as the Orchid Centre, and that saw over 2,866 people avoid A&E admissions. And we also extended our mental health support line, so that ran 24/7. So if we go on to the next slide. So recovering from COVID, it's too late to say that we have recovered from COVID, but we're recovering from COVID, and we are really excited about our new integrated world, both with our integrated programme, but also across our ICS. We want to continue to learn from the experiences that we've had and what's worked well. So in terms of our crisis, in terms of developing innovation, and what works well for patients. A couple of key examples here is our care at the point of crisis. We're moving the Orchid Mental Health A&E into the Coral Assessment Service, which will see patients having their care provided away from a hospital environment and in their own homes. We're continuing to develop the mental health crisis support line offer and offering choice in how patients are seen, whether they would like to be seen face-to-face or using a digital solution. Alongside that, supporting agile working for our staff supports an improved work-life balance and ensures that our teams are fit for the future. Building on what we've learned through the pandemic, obviously our focus on infection prevention, control and outbreak management remains exceptionally tight, and we're developing even more skills around physical health care. Real focus on testing and vaccinations, and our vaccination campaign as we move into the winter is stronger than ever. Alongside all that, we're having to manage a significant increase in demand. So we've seen a 16% increase in referrals, and with a 25% increase in our community adult services. Transformation is at the heart of our response. And our integrated programme supports the delivery of that. So later on to this evening, you will hear around our community transformation for working age adults, but also for CAMHS, ensuring people get the right care in the right place at the right time. Making sure that our people, our staff, our patients and our communities at the heart of that transformation is absolutely critical, and we will continue to develop them and our use of co-production so that they can be the very best that they can be. Our environments is the last piece of the jigsaw, if you like. And this time next year, we'll be packing up our boxes and moving in to our brand new hospital facilities, the Trinity and Shaftesbury unit. And anybody who's been on the Springfield site recently will know that we've seen a significant amount of transformation already, and more to come. But the part that I think I'm perhaps most excited about is the creation of the Springfield Village, which will see our two new hospital environments sitting alongside the new houses, the new shops and the facilities to aim at a whole community approach to mental health and well-being. We're also in Richmond redeveloping Barnes Hospital and delivering a refurbished facility at the Richmond Royal. And soon we'll be progressing our consultation and planning for the redevelopment of Tolworth Hospital. So the next slide is an integrated route map. You'll be very pleased to hear I'm not going to talk you through all the detail, but it might be helpful as a reference point to later. But basically, we're on a massive journey together over the next 12 months. And I'm determined that with the skills that we've demonstrated this year, we will make this a success. So how have we continued to achieve on our strategic ambitions? In terms of increasing quality years, very, very proud of the work we did with key partners and across the health system and the voluntary and community sector in the South London Listen programme, which really focused on prevention. And I was delighted that we were able to stand up on our online summit and commit to the asks and pledges of our community. So we've committed to developing a virtual waiting room, to ensuring mental health champions are in place in community groups and local authorities, and importantly, to paying the London living wage. We already do this to our directly employed staff, but we've committed to also continue to do this for our subcontracted staff. Significant investment in our CAMHS services has seen £2.5 million invested, and with partners across South West London, we'll be leading the CAMHS community transformation. So CAMHS stands for Child and Adolescent Mental Health Services. We've supported the development of our equality, diversity and inclusion strategy, and we had brilliant engagement. So thank you to everybody who's involved in that. And Billy will be talking us through the detail shortly. And it would be wrong if I didn't mention the Ethnicity and Mental Health Improvement Project. We talked about this at the last 2 years AGMs, and it's really great to see that our first health and wellbeing hub will be rolled out this autumn in the New Testament Assembly Church in Tooting. And we make a renewed commitment to being clear, decisive and timely on our actions within this work, noting that it is already taken too long and our communities need us to lead with them this work. Co-production, in terms of ensuring people with lived experience are really supported to develop our services. Delighted that we saw 17 new peer engagement facilitators take up role in the trust this year. One of the things that's critical is making life better together for our staff. So how have we improved things for our staff this year? If you can go on to the next slide, please. Through making the trust a great place to start. We know that happy staff provide happy, better care. So we have absolutely supported the improving the offer and health and wellbeing offer to our staff. I'm so proud of our staff networks, and particularly our staff networks chairs, who really guide the principles of making life better together around our engagement. We have developed our leadership in year with work on collaborative and collective leadership, and done lots of celebratory events where things have gone well as regular and frequent engagement, both virtually and face-to-face with frontline staff. So if we can go on to the next slide. That's it, lovely. In terms of being proud of our people, how can we not be? This year, the Stacey Dooley documentary, Back on the Psych Ward, I think that would be how she'd say it. But basically, we did that documentary, one, to showcase the hard work and dedication of our staff, but two, and most importantly, to reduce the stigma around mental health. We have been awarded the prestigious Stage 2 Triangle of Care membership schemes, one of only 20 mental health trusts in the UK, and we've been shortlisted for significant numbers of HSJ awards, and we have won the Learning Disability Medicines Optimisation in Care Homes Awards. So we know that there are still key challenges ahead. And we are fit to work and to fight these challenges, but we're going to fight them collectively with the communities that we serve. So key to our challenges, ensuring we have the right staff in the right place at the right time, looking at our increased demand and our ageing estate. And tonight I've shared with you already the actions we're taking about each of those. And I make a real commitment to co-produce and work with our communities and to be even clearer and more decisive on our agreed actions. So I think that was the end of my 10 minutes, Jenna. You'll be impressed I did it in time scale. I now hand to Flora's story. Now, Flora was a young person who used the support that she received from our school support mental health services. So we're just going to play her film before I hand to Philip, our finance director, whose highlight of the year is making finance understandable to the population. So I hope he doesn't let us down this year. So Flora.
Going to the Wellbeing Practitioner Service changed me in a very good way. Before I came to the service, I was a little bit more feeling down, and I wasn't as comfortable with talking to people as I am now. So after this, I realized I learned how to tackle my low mood. I learned how to tackle thinking bad thoughts that you may be thinking about yourself, and I learned how to love myself more. I learned to be nicer to people around me and have more patience with people. I'm so glad I done it. I'm glad I was pushed to do it because it's changed me so much. So thank you.
Well, good evening, everybody. I've got something to live up to there, haven't I, with Vanessa saying I'm going to make finance interesting and understandable to you all. So I'm Philip Murray, I'm the Director of Finance, and once again, it's my privilege and pleasure to be able to present to you the financial results for the year ended 31st of March 2021. Thank you. As you can see there's 5 key targets, all nicely ticked at the bottom of the slide, and I'm pleased to be able to say we've met all of those targets. But more importantly, in terms of you, the taxpayer, and how we use your money, you can see there that we've made a very small surplus of £50,000 in the year. For those of you that do read our accounts, you might be saying, well, no, Philip, you haven't. You've made a £1.1 million deficit. Yes, our trading position is that, although you'll see there that it takes into account some very technical issues, impairments mainly in our accounts, and the Department of Health and NHS England discount those when they look at our figures. So as far as we're concerned, we've made that very, very small surplus. And along the way there, we were able to make £9.4 million of efficiencies. And that, of course, meant that we could deliver more healthcare and more services to the population of South West London, which is really important, is what we're all here to deliver. If you could have the next slide, please. So last year, we received £220 million of income from various sources, as you'll see there. You'll hopefully realise that NHS South West London CCG is what used to be the 6 CCGs of South West London, and they make up the majority of our income, 68% of our income, with a further 18% there coming from NHS England. So just shy of 85% of our, just north of 85% of our income comes from those commissioners that charge us to provide services to you, the population of South West London, and in some cases wider, where we provide more specialist services to certain communities, up in Cambridge and down in Kent particularly. And where did we spend that money? So you'll be pleased to see here, and not unexpectedly for those of you who see my presentations in the past, that 72% of that was on pay costs. And mental health is very much a service driven by people for people, and it's therefore why recruitment and retention of staff is fundamentally important to our trust and how we can deliver services to you, the population. Smaller amounts of money, as you'll see there, has been spent in other areas. Of the pay costs, again, you'll be pleased to see, I'm sure, the vast majority of our pay costs are going on direct clinical services, nursing, medical and scientific staff. However, it is really important that we all recognise that those non-clinical staff, receptionists, medical secretaries, porters, people paying invoices, payroll staff, and too many really to mention them all, are all actively contributing towards the services that we provide to you, and without them we would not be able to deliver the quality of services that we currently do. Sorry, just getting rid of that little person entering. So what does that really mean? Well, as you can see, we spend 78% of our money, or £78 in every 100, on direct clinical care costs, doctors, nurses, drugs, dressings, etc. Obviously, we have to spend money on other things. We need buildings from which we deliver those costs. And you can see that we spent 12% or £12 in every 100 there, and £10 in every 100 on management and admin costs. What hopefully you will also appreciate is that we are gradually over the years reducing in small ways the amount that we're spending on non-clinical services, so that we are really, wherever we possibly can, focusing all of that money that we're getting on direct patient care and clinical services for you. And you'll see that those figures are comparable to prior years. As already been said by Anne, the last year, we all very much aware, has been overshadowed by the pandemic, COVID. And like every NHS organisation and many organisations generally, we've had to spend considerable money on ensuring that we can keep services going and supporting the populations that we're charged to serve. And you can see here that we've spent nearly £10 million on supporting COVID services. At the top there, already mentioned, the ORCID service and an expanded mental health support line. In addition, of course, in order that we can keep our services going, we've had to backfill staff that have unfortunately been ill. But also we've had to keep the training of students going, so that we don't stop that just because of COVID. And those students have been accelerated through their training, and we've had many of them on our site here. We've also provided extra beds and extra services in the community, and you can see there the other smaller areas that we've spent money on. And this is obviously fundamentally important, that we spent this money to enable us to support mental health services and to keep them going, as Vanessa said in her previous talk. In addition, we've spent considerable amount of money on our estate and our capital infrastructure, and you can see there the majority of that, 57 of our 62 million, has been spent on the new buildings that you can see going up around us here on this Springfield site. And those are actual pictures. So the one in the top right is actually the architect's impression, but the other two are the actual pictures of the site going up. And I was recently shown a picture of the new building next to the architect's impression, and amazing to see that the two are so similar that you can rely on. You can see something like that when the trees are established in the new buildings. In addition there, obviously we do have to maintain our estate and keep it going until such time as that we move into the new building. And we have also invested considerably in our digital technology. And Vanessa's already mentioned some of the things that was on in order that we could do video and other technologies, or put them in place so we could keep seeing people without them having to come into hospital. And then lastly, as we look forward, there are obviously risks and opportunities. I won't plan to go through those because I'm sure you'll be far more interested in hearing about the quality of the services and some more video vignettes. But it's clearly a continued uncertainty with coronavirus and what that means for us all. We know that nationally, including here in South West London, there's increased demand for mental health services. But we also know that the government is committed to increasing its investment in mental health services. So these are opportunities for us to be able to invest further in mental health, to develop services to support the needs of the population. We will, however, need to do savings and make efficiencies going forward. That is a national requirement, and it's going to be fundamentally important that we are able to recruit and retain our staff. As I've said before, without them, and many of you will be on this call here now, we cannot deliver the services that we aspire to and continue the good quality of the services that we've herefore provided. Thank you for listening, and I'll now hand you over to Sharon Spain, our Director of Nursing, and Dr. Billy Boland, our Medical Director. Thank you.
Hello, hi everybody. I'm Sharon Spain and I am the Director of Nursing and Quality, yeah, really proud to be the Director of Nursing for South West London and St George's. I'm just going to, I've only been given 5 minutes, lucky for you, and then I will hand over to Billy. But I think Vanessa did a really good job at summarising the work that we've done over the last year. And I think it's just really important to recognise that actually our staff, our patients and our communities have lived through just an extraordinary challenges this year. And I think we are really, well, I know we are really proud as an organisation at how well our teams maintained their focus and continued to provide the best standards of care to our patients throughout. We're also enormously grateful to the local communities that you've been exceptional with the support that you provided us, and particularly at the peak of the pandemic in so many different ways. It was such an excellent community piece of work. We've mentioned here about maintaining the quality of our services. The teams just worked through and I think our clinical frontline staff, it's been so challenging for them. It was really unprecedented times. People were really frightened, people were really scared, but actually people still got up and came into work and did their very best. We did a really good job actually in our quality response to COVID-19 throughout the pandemic. We created a really safe environment for our patients. Our infection prevention control standards were really tightly monitored. We that in turn then allowed us to really safely manage and prevent or reduce the risks of the transmissions of the infections from patients to staff and staff to patients. We did an amazing job with our vaccine centre, vaccines for patients and vaccines for our staff, and our testing and testing of our patients and staff as well. So that's kind of a quick summary to where we were in quality. So I'd like to talk about our key priorities that we've got for 21-22. And these are our 5 priorities, which are all very much quality and patient improvement of patient care and patient experience. So we've got our safety in motion, which is it's a great programme that we've pulled together and we've developed it as an organisation, and that's to look at how do we reduce any restrictive interventions for our patients, and also how do we look at levels of violence and aggression and what do we need to put in place to support people who are really unwell and to support our staff to manage people. We are putting in place, logically, the management of the long-term side effects of COVID-19, and that will be done through training of our staff, training and courses for our patients and carers so they can understand some of the long-term impacts and actually how can we help you manage those. We have a suicide prevention strategy, which Billy and his team are leading on, and within that, we really need to understand some of the themes and some of the causes around suicides for people who we look after. And we are also established a dual diagnosis group, which we know from a lot of our suicides that dual diagnosis is a common theme throughout. Experience challenge, so our patient experience and what you as community and people who use our services experience is really important to us, and we've set up a group which has service users and carers on it, and it looks at the quality and the compassion of how we respond to concerns that you raise to us, and that is really important, that we're really hearing and we're really listening and we're really learning and changing our practice and changing our behaviours from your response. And then finally, which is a great initiative, it's the patient choice in medication. We know medications can be really difficult, and some of the side effects are difficult. And I think for people when they're really unwell, it's a hard time for you, and it's a hard time for our patients. So this is a really important piece of work that's being led by our chief pharmacist. So that is my allocated time, I think, and I'm going to now hand over to Billy Boland, our medical director.
Thanks so much, Sharon, and hello everybody. It's so lovely to see so many people here. I know we're already a bit behind time, but I do want to just take a few moments to talk about the EDI strategy, Equality, Diversity and Inclusion strategy. It's huge honor to talk about this. I have just come back to the organisation, so this today actually. 9th of September marks 6 months of me being medical director at this trust. But I was formerly a trainee here. I trained in psychiatry in the trust. I went away to practice as a consultant for a lot of years, but I'm delighted to be back. It really feels like coming home, and I'm just so blessed to be on this journey with you all. So these you can read it for yourself what we're hoping to achieve with equality here. And this has been co-produced with our staff and patients. We're in the first year of implementation of it, and we're already starting to make some progress. You can see it's grouped into these 3 themes around what we're trying to do with our structures and processes, what we're doing strategically, theme 3 there. But in the middle, we're also trying to do stuff about our culture and our behaviours. And we know if you're trying to do work in equality and diversity, you know it's hard work to do. It's emotionally demanding. Vanessa highlighted the inequalities that we know that the pandemic has highlighted amongst different groups in society. And I'm really mindful that as a white gay man, I've got both privilege and I've experienced discrimination, and so working towards equality is something that's really important to me personally. And I know we as an organization don't always get it right, and I don't always get it right. You know, we have to, mistakes are made along the way of trying to change our approach to inclusion and improvement. But yeah, really, really keen to keep working on this journey with you together. So thanks. That's all I wanted to say. We're going to have a video from Sonia now, who's a young person who used our CAM services. And then after that, I'm going to hand you back over to Anne for the Q&A.
It's a pleasure for me to be able to report back on how we found the services provided by CAMS. My daughter went through a rough patch. She developed anxiety, depression, what she started to describe as kind of feeling grey. And for the first time in my life as a mum, as a parent, I felt that I couldn't reach her, that I didn't literally know what to say or what to do to make her better. And I'd had a previous experience of mental health problems with mental health with her, and we by word of mouth we had gone to a private counsellor. And that type of help had not helped a great deal. And so I decided to just raise my concerns with our GP, and the GP referred us to CAMS. I never heard of CAMS before. And we were assessed in a pretty kind of timely fashion. Well, we waited for a few weeks, but then I got a phone call from the same a therapist who then offered Bianca 10 sessions of CBT spread through our school year. From the very beginning, the time we had with, I hope I'm allowed to say the therapist's name, was Catherine Slay. We felt the sessions with Catherine were quite literally a safe haven. I was asked, Bianca was asked whether she wanted me to sit in on these sessions or not, and she said that she preferred if I was with her. So I experienced the journey with Bianca, and starting from a position of slight concern on my part, because I am a full-time working mother of two. So Bianca is one of my two daughters. And the thought of having to make time in my very busy schedule as a parent and as a professional for these sessions, initially I thought it was going to make me more anxious about my own challenges. And in fact, I benefited, I think, just as much as Bianca from Catherine's support. Catherine was a perfect mixture, I thought, of being professional and friendly, being solidly there and allowing for kind of space for Bianca and for myself to give input into the sessions. And she provided very practical steps on how we could cope when we were back home by ourselves.
So thank you, Billy and Sharon. We now have time probably only for a couple of questions, but as Jenna said at the beginning, there will be an opportunity at the end to ask more questions, and those that we don't get to today, we will make sure that we answer in full. So the two questions I'm going to take now, we've had a question from Suresh around sales of plots at Springfield and whether this will be enough to fund the developments at Tolworth. And I will ask Ian to answer that. And after that, I will ask Billy to come in and say a bit more on Candace's question in the chat around health inequalities. But let's start with Ian.
Thank you, Anne. Good evening, everybody. Suresh, thank you for the question. As you've heard throughout the presentation so far, the work at Tolworth, work at Springfield is already ongoing. We've spent the capital receipts from the first tranche of disposals of about £150 million in producing the scheme so far. The specific question, Suresh, was around have we got enough to fund Tolworth? We've already started the second tranches of land disposals. The phase 2A has been out to market. We haven't concluded those commercial negotiations yet, so I can't confirm the figures we've got, but they're in line with the business case that we had, and we're on track for delivering Tolworth, Barnes and Richmond and beyond. And I think it's important to say as well in that we're starting the process of the Tolworth design, working with the Barnes design, and co-production of both of those is really important to us, along with Richmond Royal Solutions as well. So just to conclude, yes, we're on track for delivering the money that we need for the investments, and we're also on track for designing fantastic facilities that learn from the phase 1 facilities that we're doing, build on that through co-production with our people, service users and communities. Thank you, Anne.
Thank you very much, Ian. If I could just ask people to put their questions in the chat. We're not taking verbal questions at the meeting. But Billy, Candice posed a question that's had a few other people join in the chat around what we're doing to reduce health inequalities. Could you say a little bit more about that, please?
Oh, yeah, sure. No, thanks so much for the question, Candice. It is so important. And we need to think about health inequalities in the real broadest sense, right? So we need to think about access to our services, making sure that they're equitable and that no one is discriminated against when they're trying to get into mental health services. We need to look at the type of interventions that we offer people, so to make sure that they're offered equitably and no particular group of people that use our services misses out. And then we also need to make sure that the outcomes that people get when they benefit from our services are fair as well, and that outcomes are equitable for all. So it's really hugely important. You'll have seen in the EDI strategy that we put up a number of different initiatives that we're moving forward. You can see Malik Gul has mentioned about the MHIP program that the organisation is committed to and is directly intended to reduce health inequalities. So the number of different initiatives going on in the organisation, but you're absolutely right, it needs to be central to what we're doing. And I'm really pleased that it is embedded in our EDI strategy. But thanks for the question.
Thank you very much, Billy. As I say, there will be time for questions at the end. So at this point, I propose to move on to the second part of our agenda, which is about our place in the local community. And I want to invite Michael Wood, who is Head of Health Economic Partnerships in NHS Confederation, to say a few words to start our second part of our meeting. Thank you.
Thank you, Anne, and evening, everyone. It's a pleasure to be here to listen to your achievements in the past 12 months, but also to kick off what is a really important discussion. Before I introduce Bola, I just wanted to say a few words from a London perspective. So my name's Michael Wood. I'm advising NHS London on the development of an NHS anchor network across the capital city. So in plain English, this effectively means we are here to support you and other NHS organisations to help make your communities both better and better off. We're doing this for the obvious reasons. We know that across London, people have been impacted in a range of ways by COVID. It's an economic, a cultural, a social crisis, as well as a health one. And if we really do want to turn the tide and improve population health and well-being and narrow those inequalities, we need to go beyond simply the services that we in a health service provide. The Chief Executive of NHS London, Sir David Sloman, my Chief Executive, he speaks with the Mayor of London on a weekly basis. And this issue, what I'm talking about, what you're talking about, is now what they speak about. Questions, how can we work in partnership to support Londoners to secure good jobs, the jobs that pay the living wage? How can we use the NHS pound to the best effect with our local businesses? What is our offer in the NHS to young people, given the particular challenges they face and they continue to face? How can we move our deliveries, for example, net zero? I could go on, but I hope, Anne, that the message is loud and clear, that the NHS in London understands the importance of its civic, its economic, its social role in London London's wider recovery, and we're here to listen and to support. I'm familiar personally with the South London Listens campaign and really keen to follow the progress and the partnerships you make through this. I think, if we're being frank, in the NHS, community engagement is sometimes a challenge for us as a statutory organisation, but this example, your example, is one that we need to be shouting about to all four parts of the city, and NHS London is committed to supporting you in that. So that's enough from me. We're going to turn to the national picture now. And fantastic to have Dr. Bola Owolabi with us. Bola's the Director of Health Inequalities at NHS England and NHS Improvement. She's a hugely influential figure in understanding the NHS, how it can prevent and reduce poverty in our communities. Bola's team within NHS England is responsible for the NHS anchor work and provides that leadership in a way which enables us at the city or the system or the borough levels to embed and to work in the best way for our communities. Bola works as a GP in the Midlands. She's held various leadership roles at local, system and national levels, and she was until recently the National Speciality Advisor for Older People and Integrated Person-Centred Care at NHS England. Bola, it's a pleasure to hand over to you.
Thank you so much, Michael, and thank you indeed for the invitation to join you this evening. I really do consider it a privilege to be able to share this space and this time with you all, and for your very kind introduction. If I could please go on to the next slide, please. I hope you can hear me. Thank you so much. Sorry, I seemed to lose power just then. I like to start with why, and that's not an original statement. It has been said by others, but I find it incredibly powerful and useful. And when I arrived in this role in January of this year, I concerned myself with speaking with people, loads and loads of people. And the reason I was doing that is because I wanted to get to a place where we can crystallize why we're doing what we are doing in the National Health Inequalities Improvement Program. And I do believe that the statement that we have arrived at is the voice of many people, and that is where its power lies. I believe the why is that we do want to deliver exceptional quality healthcare for all, and I underline for all, to include those people and communities at the margins of our society who have less voice, or in many cases, no voice. So our mission is exceptional quality healthcare for all through equitable access. People need to be able to get across the threshold, but it can't stop there. We are also committed to the kind and the type of experience they have. And so our other dimension is that people have excellent experience once they've crossed the threshold, and that we work to make sure that their outcomes are as optimal as they can be. This is the vision that we are all coalescing around. And I believe it is the same vision that has gathered us here this evening. And if I can go on to the next slide, please. I just here want to talk a little bit about legacy. So Michael very helpfully mentioned the season and the period that we've all just lived through, and in many ways we are still living through, i.e. this COVID pandemic, genuinely unprecedented in all our lives, in every dimension. And if you look at the various publications that have come out through the course of the pandemic, whether that is the Marmot second review 10 years on, whether that is the King's Fund reports on the health inequalities impact of the pandemic, or the Health Foundation's reports, or the COVID disparities report, or beyond the data, I could go on and on. Every single one of those reports that have been written through this pandemic, you could draw a solid line through them and titled that line, Health Inequalities. They're not new, but what the pandemic has done is to force our attention ever more powerfully on these pre-existing health inequalities that have been highlighted and exacerbated by the pandemic. And so for every one of us on this call, what will our response be? So what? So what to all the publications and the reports that I've just mentioned and many more? I think the so what is the legacy conversation. I genuinely believe that the most powerful and enduring legacy that we can all leave behind us from this awful pandemic is the legacy of narrowing health inequalities. Not because they're new, but because now more than ever, we can no longer ignore them. If we don't address health inequalities for any other reason, I put it to you, let us at least address it because of the legacy that future generations will judge us by. And if I go on to the next slide now, I just want to bring people into the room. I start with people as the most powerful drivers of why we must do this work. You'll all have been aware of the life expectancy gap between the most and the least deprived communities. And we know that gap has actually worsened for women in the most deprived areas over the course of the last 10 years. People with learning disabilities, we know they have a 10 to 15 year life expectancy gap compared to everyone else. People with severe mental illness, 15 to 20 year life expectancy gap compared to the average population. If you look at our screening and our vaccination programs, we work incredibly hard to reach the communities at the margins, but you'll agree with me that we have work to do yet. You look at the Embrace report and what it tells us, that Black women are 4 times more likely to die in childbirth or the year following delivery compared to their white counterparts. These are the drivers of the work that we all have to do. And if we are going to achieve the government stated ambition of 5 extra years of healthy life expectancy by 2035, we must address these human drivers that I share with you this evening. In addition to the human drivers, we have the policy drivers, which I will now speak to in the next slide. We're not operating within a vacuum of policy. Way beyond the pandemic, the NHS in our long-term plan had stated our absolute commitment to tackling health inequalities. If you look at the government's mandate to the NHS, it specifically says that the role of the NHS in levelling up is to address health inequalities. Simon Stevens' phase 3 letter, written at the height of the pandemic in 2020, set out the 8 urgent actions for tackling health inequalities. You'll have seen the NHS operational planning guidance that we published on the 23rd of March, where we've summarized those 8 urgent actions into 5 key priorities for addressing health inequalities. You look at our elective recovery fund, we've got health inequalities in it. The integrated care system design framework that we published in June 2021, we've writ large health inequalities. You look at the implementation guidance, working with people and communities that we published just in the last few days, again, writ large, tackling health inequalities. This is our policy landscape. And if I go on to the next slide then, to drill a little bit more into, again, who we're talking about. People from our ethnic minority communities, people from the most deprived communities, those that we describe as inclusion health, experiencing homelessness, and just lack of sustainable housing, significant representation amongst people with mental health issues, people with learning disability, people with severe mental illness. These are the people that we're talking about, and they're impacted not just by life-cause conditions, i.e. diseases, but they're impacted by those wider determinants: education, income, employment, or the lack of it, the things that powerfully drive their health inequalities. These are the people that we're talking about, and these are the dimensions and the lenses through which we're looking at them. So what can we do? And therefore, I want to now talk in my next slide about the roles that the NHS can play. We said in the long-term plan that we cannot treat our way out of health inequalities. That is true. However, the NHS has a powerful, impactful, meaningful contribution to make as a service commissioner and provider, as an important partner within integrated care systems, and yes, as an anchor institution, able to make a social value contribution to tackling those health inequalities in our communities. And I want to drill down a little bit more into that anchor institution segment. And so on the next slide, talking about the role of the NHS as an anchor institution, it's great to see Citizens UK on the call. The NHS as a community connector. In many communities, the NHS is the most abiding presence. We are the anchor institution in many communities where there is no other industry. And therefore, we must not neglect our role as the connector of the community. In the employment practices and decisions that we make, the opportunities that we are able to create for those young people, for those people with mental health challenges, and many others who experience disadvantage, the way we use our estate, where we choose to put our services. Do we proactively and meaningfully inquire into whether our estate is actually serving the community in a way that addresses health inequalities? Our procurement, the NHS is a huge buyer. As we make our buying decisions, how do we ensure that our procurement decisions are done in such a way that the communities in which we exist, the communities in which we are the anchors, benefit from our procurement practices and decisions? And finally, as we design our services, do we design them with the voices of the people at the margins, at the heart of the decisions that we make, so that we do deliver on the ambition and the vision that I stated at the beginning, to deliver that exceptional quality healthcare for all by ensuring that equitable access, that excellent experience, and the optimal outcomes that we're all here to deliver. Thank you so much for having me, and I look forward to the conversation that we will have.
Thank you very much, Bola. I think we now have some contributions from 3 of our community leaders. Is that right? Tiff, Rachel and Yvonne?
Good evening. I think this is the right time for me to turn on my camera. If I turned it on much earlier, you would have seen me cooking chicken and chips for my family whilst listening in. So I hope I've got this right. Good evening. My name is Reverend Tiff Ewins, and I'm the vicar of St Michael's, Wandsworth Common, just over Wandsworth Common from Springfield Hospital. We are so grateful that you've invited us to this meeting today, and it's my role to just remind you of how we got here. In the aftermath of the initial lockdown in 2020, South London Listens saw local communities hold conversations with over 5,700 people about mental health. Many of these were carers and service users. All of us had experienced the pandemic in different ways, and effects on mental health was a common and concerning theme. From this listening, we developed workshops to understand the key issues and develop solutions. From changes that you could make as the Mental Health Trust to things that we could offer as local community groups. Today, we want to focus on 2 areas identified. one that we're pushing on with as community institutions, and one that only you can make happen. These are in turn our development of mental health hubs, and secondly, the launching of a CAMHS virtual waiting room, which only you can do. So we're going to hear now first from Rachel and then from Yvonne about those two issues. Rachel, good evening and over to you.
Good evening. Hi, I'm Rachel. I'm from Mitcham Parish Church. I also work for the Slam Recovery College at South London Maudsley, offering training to people who help with mental health problems. I'll never forget that one Sunday at church, I spoke to a young mother who struggled as she was trying to cope with her panic and anxiety and her 2 children and a disabled husband. She was upset, and I listened to her problems and offered her support. It was a small thing, but it helped. I was inspired to offer training to other community leaders in Merton so that they could be there to listen and to support others. Our aim was that people would be no more than 10 minutes away from someone to talk to. Thanks to South London Listens, our community organisations will now become hubs where people feel safe to talk about their mental health. Churches, mosques, synagogues, schools, migrant organisations and more are in the process of planning and developing hubs. We are delighted that South West London St George's Trust agreed to work with us to train mental health champions and to support and resource the hubs. Together, we can make sure that no one suffers in silence. I'm now going to pass over to Yvonne.
Okay. Good evening. My name is Yvonne. I'm a mother and a grandmother living in Wandsworth. My son is now in his 40s, but when he was a teenager, he developed behavioral problems. I wasn't aware of mental health issues, nor was his school. We just didn't have any information. We just put it down to him being a rebellious teenager until he was sectioned. Once he went into Springfield Hospital, it was hard to go back. And then from Springfield, he went into supported accommodation. And it has been a lifelong challenge. I feel things could have been better if I and his teachers at school had more awareness and information. Maybe he could have got help earlier and things would have been different. That's why the virtual waiting room for CAMHS that St. George's has committed to is so important to me personally. It will give young people, parents and teachers an online space to get the advice and guidance they need while they wait for service. It gives me hope that another generation won't have to go down this route. Thank you for listening.
Yvonne, thank you for that. And I'm aware that even in the last week, a family in my congregation find themselves in the eye of a mental health crisis regarding a teenager in their family. And I know afresh how important this CAMHS virtual waiting room is going to be. So those of you who have been close to this work will know that it's our desire to work together as friends. And good friends don't let each other forget or delay on their promises. So I have a very specific question to put to Amy Scammell this evening. Amy, on behalf of the Trust, would you agree to meet with us? Good evening. Thank you for popping up. It's nice to see you. Would you agree to meet with us on the 7th of October so that you can tell us who is going to be the lead person on the CAMS virtual waiting room project, and to give us a launch timetable for that very important new service.
Thank you, Tiff. Thank you, Yvonne. Thank you, Rachel. And yes, we'd be absolutely delighted to meet with you on the 7th of October and to work out our plans to move forward the really important South London Listens and mental ill health prevention programme work. Absolutely delighted. And it's been an absolute pleasure working with you today. So thank you for everything that you do.
Brilliant. Well, I very much hope we can continue to be a pleasure to work with. That's our intention. And we'll look forward to working with that lead person when we find out who that is. And working to your timetable from the 7th. So thank you, Amy, very much for that positive response. All of us here tonight, all of us serve the people of South West London in various ways, as community institutions and leaders, as community members, as people with health vocations, and as public servants of all kinds. We have heard in our listening campaign the need for action. But as we say in these parts, in South London Listens, we say, together we can. Thank you and good evening.
So thank you so much to Tiff and Rachel and Yvonne, and we finally reach our last session of the evening. And I've got a hard act to follow, haven't I? Because actually all our previous speakers have been absolutely fantastic. So thank you so much. I am going to lead us in our last set of slides, which really looks around the power of collaboration. And I'm really delighted to be joined in this talk this evening, by my colleague Michelle Rahman, who is the Director of Transformation for the Sutton locality of the South West London CCG. So we are going to talk about the power of collaboration. So first of all, I'd just like, we can pop to the first main slide. I'd just like us to talk a little bit around what we mean by collaboration. I think it's a term that's sort of used quite sort of frequently, but not necessarily well understood. It crops up a lot in discussion and in guidance. And actually, it's a very, very simple definition. We're effectively working with others to produce an object, an item, something, or to deliver towards a common goal or a common benefit. Now, given that we're very social creatures as humans, you would think that this would be actually relatively simple. However, actually, invariably, it's complex. It involves challenges and complexities, and many barriers actually exist. And some of the barriers that we face are listed here in our first slide. So a lack of time, a lack of understanding of each other's positions, competition or conflicting goals or priorities, lack of information, an absence of trust, poor communication. There are many, many things that tend to get in the way of trying to work collectively together. And I guess it's worth us now just moving on to our next slide to think about why we should work together in healthcare. You know, what is the importance of this? It can be tempting, I think, when we're facing challenges to sort of hunker down a little bit, to think that we can actually address things much more easily on our own, to actually focus our time and work individually. But the truth really is quite simple in that it's much easier to achieve much more collectively than singly. Working together collaboratively is the right thing to do. It really is putting the patients and our service users and carers at the heart of the work that we're trying to deliver. When we work collectively, we draw on different people's diverse thoughts and backgrounds and experiences, and we're much more likely to come up with creative and innovative solutions. We also hear different perspectives, and we can really think about how we actually improve outcomes and experience. Also, when we work collaboratively, we improve our communication, our understandings, and our relationships with one another, and it reduces our duplication of effort. It tends to make us more efficient and better able to direct our quite scarce resources appropriately. And I suppose I would say at the moment, there's a real imperative to work collectively for our future development and our sustainability across health and care services. We've seen over the last 18 months with the COVID pandemic, the real challenges that we've all faced. And actually, there's a huge importance of supporting one another and also offering mutual aid between organisations. We know that actually we have a fantastic health and care system, but it is really stretched. The demand continues to increase and we can't tackle those challenges alone. And actually collaboration now is mandated for health and care within the new Health and Care Bill and the associated policy documentation. And I think for us as a trust, just to reflect, we have 5 values, which are at the bottom of the slide there. Many of you will recognise those. And collaboration is one of those. It really runs through the heart of the delivery of our trust strategy. So it's hugely important for us to collaborate. We've popped to the next slide. Now, having said all that, there is so much published around integrated working, around how to develop partnerships, how to think creatively and work collaboratively. And there is a lot of guidance published. There are blog posts and briefings, thousands and thousands published all the time. And there are very many different change and varied models. The challenge is really understanding what we do with them and what we can take from them. So if we pop to the next slide, I think there are a number of really important things that we need to consider as success factors when we think about collaboration. Basically, there are a number of elements, if you like, that we need to create as conditions for us to move forward collectively. So, for example, mutual respect, understanding and trust, really trying to understand where each party in a collaborative relationship is coming from, making sure that we engage widely and that we communicate well and frequently and in an open manner. We need to have success stories, ideally, to build on, to show people the art of the possible and what we can achieve when we work collectively. And then, of course, we need to be able to compromise and be flexible and try and understand that the greater good is often may mean that we need to step back and reconsider our own individual motivations and requirements. I think also, we need to make sure that we have structured plans and we're very clear at saying sort of what we're going to do and when, and actually making sure that we follow through on action. And that will often mean we need to have complicated conversations around resources and capacity and who is able to contribute to which pieces of work. So for us at the moment in a trust, we're really thinking about how we start to create that environment and build on the collaboration that we already have in place. If we just pop to the next slide. Thank you. So I think at the moment we've got a fantastic opportunity to think about how we develop our collaborative working through our community mental health transformation programme. Many of you will know about this programme. We've received funding under the NHS long-term plan to implement a new model of delivery for people with serious mental illness in our community services. And that work really looks at removing barriers between primary and secondary care. It looks at developing an integrated and coherent model where people can step up and step down and flexibly access the resource they need. It looks at developing, I think really importantly, multi-agency teams for delivery. So working alongside colleagues in primary care, working alongside colleagues in the voluntary and community sector, and other partners in the different care and health elements of our economy. It also allows us to think very carefully around co-production. And Christian, I was really pleased to see the question you asked around open dialogue, because this is exactly the programme where we're able to think very carefully about open dialogue and what we're able to do to think about that programme again. So thank you so much for raising that. Many of you will know that our community transformation programme is building year on year over 3 years. And we have been really excited this first year to start our work in Sutton. And the first thing that we're really trying to do is to work with partners to understand how we build those relationships and how we need to work collectively to be successful. And so right now I'm going to hand over to Michelle, who is just going to give us a little talk through on our next slide around the way that we're approaching collaboration in Sutton. Over to you, Michelle.
Thank you, Amy, and it's a pleasure to be here. So we have a real rich history of collaborative working in Sutton, and that was established through what we've called our Sutton Health and Care Alliance, which was established in 2017. It's not just about how we work together, how we say and describe the way we work together. We've written it down. We've got some core principles of what it means to collaborate for the benefit of our population in Sutton. We have a shared vision and purpose, and at the heart of that purpose is our patient. Our patients are certainly at the heart in terms of their care. We also have a shared principle on getting the best out of what we call our Sutton pound, and how we align resources to make sure the right provider within our place of Sutton is delivering the best care for the individual, depending on what that provision is. We invest a hell of a lot of time in developing our relationships, and that's really, really important, because what that's done for us is it's helped us to learn from each other as individuals, but also about our organisations, so that we understand the pressures, the challenges of our organisations that we're working with, and the visions that are there too. We developed our supportive working outside of our core practice, and you'll hear us talk in Sutton about the blended teams. We try to be kind to each other. We care about our challenges, our collective challenges, and challenges that we have within our organisations. And we do look to seek for a win-win solution all of the time. We don't always get it, but we try. We make best efforts to try. Now, collaboration isn't always plain sailing. You know, we do have discussions, we have debates, and sometimes we are wiggling uncomfortable in our chair. But actually, it's about us taking responsibility for our common issues, our common challenges. And we have also been very clear about the things that we need to do together. And we have written that into what we call our local health and care plan. What's important for us also is how we've designed our inclusive structure for decision making, and how we discuss the information sharing that goes to inform that decision making. Critical really for us in terms of our collaborative working is delivering improvements in care, being focused on outcomes, wanting to really in real terms improve the experience of the population that we serve, but also not shy away from big issues. We want to and we do tackle those big issues. So in the place that we call Sutton, we are committed to our partnership working, and particularly around mental health, and I couldn't stress that enough really. We certainly have seen the need in our population, and particularly over the last year of COVID. We're using a population health management approach to assist us in addressing inequalities, and to that end we are absolutely supportive to the mental health transformation programme, including the brilliant approach that Amy has led in terms of the development and its delivery. But, you know, don't just take my word for it. We now want to hear, we ought to hear from some of our wider colleagues.
Collaboration and collaborative working is essential to improve the services that we deliver so that it meets the needs of our service users and carers. By collaborating and ensuring we are person-centered in our approaches, we will improve the health of our local population. In the Trust, we work collaboratively in many different areas, but we still have areas that we can improve on. As part of the Community Transformation Programme, we are currently piloting a new operating model in Sutton, where collaboration has been key to the progress that we have been making. We asked some of our partners to share their experience of collaborative working, and this is what they had to say.
From my perspective, collaborative working is when teams and individuals are given equal relevance and value in the system that they're working in. I'm thinking of a quote from the King's Fund document, Caring to Change, where they talk about true collaborative working really is about expanding our perspective. And it's when teams don't just think about the work that they have to do, but they have to start thinking about how they can support all the other teams in the system to deliver the best work and to deliver the best outcome for the system as a whole. I think we're starting to get to that place in the community transformation with the work that we started in Sutton. I'm really excited about that as different partners come together and think about the community mental health pathway within Sutton, And I'm excited to see how that continues as we do the work through the next couple of years in Kingston and Richmond, and then Merton and Wandsworth.
For us at Off the Record, collaborative working really brings together the strength of both partners. So the clinical strength of the NHS alongside the innovation and flexibility and community reach of the third sector. Of course, good collaboration needs to benefit both partners, and that's certainly been our experience. But most importantly, that collaborative working needs to be delivering stronger, broader, more flexible and accessible mental health support for people in the local community. And we've really seen firsthand the difference that good partnerships can make, both to individuals who are receiving support, but also importantly to the whole kind of design and delivery of mental health systems.
I'm lucky to be part of a team working in Sutton, designing new services in community mental health for people with serious mental illness. And I've been part of a team from primary care and South West London St George's, and also members of the voluntary sector, and also working with people who will be using those services in the future. And we're hoping to introduce those services in the next year. And I'm really looking forward to being part of a collaborative team in the future.
Collaborative working with the NHS, to me, means that it's all organisations working together alongside the individual to ensure that their support is joined up across all of health and care, and what matters to me is heard by all involved in that care. It's about bringing the strengths of all organisations, statutory, community and others, together to support that individual with whatever support they need to make their life easier or better. It's also about being person-centred, so supporting what matters to the individual and also working to the same aim and working towards common outcomes. Collaborative working, to me, is about increasing an increasing level of trust, building between organisations and sectors involved in this space, so that each recognises their areas of skill and that expertise belongs within organisations at all levels.
Sometimes service users feel a bit intimidated and feel that they haven't really got anything to say. But I think it's a good thing, and it is hard, but it sometimes brings the people producing these services or organising the services to understand what the basic things matter. What will happen? How will it improve? And will it improve things both ways for service users and for staff working in those areas? I think it can only be good that these things working to co-produce, not just tick a box, not just a little consultation, actually changes things to be better for everyone. So I would say that working alongside this new transformation in Sutton has been quite an eye-opener, because it's included people who've never done this. And it's taken some time for people who really haven't been around service user voices to get on board. But it seems as though we're moving forward with that. I don't like that term, but I'll use it. And that we are getting towards the end, and hopefully this will be a good service for Sutton.
Thank you very much. I had one more slide. Not sure where that's gone. I can tell you what was said on the slide. That's probably the easiest thing to do. So can I thank all of my colleagues in Sutton. We're really pleased to be working with you on the Community Transformation Programme, and we hugely appreciate all your time and generosity of spirit, your commitment to doing this work with us, and for investing energy in moving forward services for people with mental health issues. So huge thanks to all of you. And I'd like to thank Michelle personally. She won't like me doing this, but I'd like to thank Michelle personally for unfailingly trying to knit us together and to think about different people's perspectives and being a kind and generous colleague to work with. So thank you to colleagues in Sutton, and we look forward to moving forward together. Now I've taken a small leaf out of Tiff, Rachel and Yvonne's book, and I'm ending us, if that's okay, on a request for help and a request for action, really. So I think as a trust, we've done some fantastic things around collaboration, but we have much more that we can and should be doing. And I would like to ask for all of your help in doing this with us. So the things that we recognise that we need to do more of are on this slide. I suspect some of them will resonate with all of you, and we would like you to come with us. Help us do this, talk to us about how we can do things differently. So we recognise that we need to listen more, we need space to build relationships, we need to be more visible in our communities, and we need to become more comfortable with not having all the answers and all the solutions, and being able to reflect and accept that sometimes we get things wrong. We definitely want to develop our collaborative working skills and our collaborative leadership skills within our organisation. So again, we'd really appreciate your support with this. And we want to make sure that it's not just talking about how we do things differently, but that actually we consistently follow up and deliver specific action to specific time with commitments. So I feel optimistic that we have fantastic things that we can move forward together with, but actually we really need your help and engagement. So can I please just close by saying thank you for listening, thank you for your support, and please join us on our collaborative working journey. Anne, back to you. Thank you.
I think now I've finally managed to come off mute. So I hope you'll think that we've had a really rich series of presentations this evening. We heard from Michael and Bola about the importance of health inequalities. And that was one of the things that I think the last year has been brought home to me most starkly. I listened to a presentation from an American professor about the impact of constant microaggressions on people who are Black, Asian and minority ethnic, and how that increases their physical age in terms of health. And that's why I am so determined that we do something about that. We've had a brilliant journey with Citizens UK as part of South London Listens, and we are absolutely committed to our pledges. Thank you, Amy, and your colleagues from Sutton on the journey there. I'm really optimistic about some of the changes in the system and the opportunity to join up physical and mental health at place and really get to dealing with individuals holistically and improving their lives. And the work that showed the importance of collaboration and how we do things as well as what we do. Now, we've had a number of questions in the chat. I will do my best to try and précis them so we can get through a number of them now in this second Q&A session. So the first question I'm going to go to came from the people who are at Springfield, and there's a question from Christian about restarting open dialogue. Now, I'm not sure whether Billy or Amy are going to pick that up, but just as a bit of warning, I'm going to come to Sharon after either of you to pick up Roy's point about using people with lived experience, not who are just necessarily current service users. So Amy first.
Thank you, Anne. And Kristen, thanks so much for your question. So through the Community Transformation Programme, we'll absolutely be looking at open dialogue. So I'd like to, I know you're here, we're across the hall from one another, so I'll come in and have a chat with you when we finish this session. But thank you for picking it up and reminding us of the excellent work that had been done.
Amy. So we had some, we've talked a lot about co-production, Sharon, in our ways of working, but we had some quite important points in the chat from Roy about people, not just necessarily current service users, but people with lived experience. So perhaps you can say a bit more about that.
I will give it a go. Yes, Anne. So we, for those of you who don't know, we have done a huge amount of work over the last year, 18 months on co-production and involvement. We've got an excellent team. I think some of you are on the call actually. Excellent team, and it is all about selecting those right people from our local communities who've had lived experience or who have looked after people who have been unwell, and we really try and embed everything to be co-produced from the very beginning, in the true meaning of it actually being co-produced with service users, people with lived experience and carers, to make sure that we're actually hearing and understanding it right from the very beginning. We have now got people with lived experience, carers, service users in all of our governance structures and our governance groups, so meetings, and it's been invaluable actually. So I hope that has helped to answer your question.
Thank you very much, Sharon. I'm sure there'll be comments in the chat if it didn't. I'm now going to ask Jen. There was some very nice comments from Councillor Graham Henderson in the chat, and some concerns around demand, waiting list, staff shortages. So I'm going to ask Jen to say a bit about that. There was quite a lot of detail in that question, but also one of our regular supporters, Kathy Sheldon, has asked some points around some of that information by borough. So perhaps, Jen, you can talk about how we publish some of our information and how people can have regular access to it. Jen? You seem to, I don't know whether Jen is frozen. She seems to be on mute. She can't get in. So whilst we're doing that, I'm going to, I haven't given Vanessa notice, but this is what you get for being the chief exec. Suresh has asked some questions about changes I'm prayseeing, changes around ICSs, moves in the system. And I've interpreted that question as, what does that mean for our trust? How will we engage? What's the future looking like for us? So if perhaps you could pick that one up.
Yep, I can pick that one up, Anne. So, Suresh, we remain absolutely committed to the work that we're doing across South London Partnership. And as I said in my presentation, it makes us stronger. So that commitment to group working across with SLAM and OCSEs is fundamental in there. But you've also heard today how we've strengthened our focus at place and system level. And I think one of the things that we discussed today at board, in fact, was the importance of developing our leadership and capacity and capabilities to ensure that we sufficiently influence those agendas. Every year, Suresh, as long as I've been here, you've asked if we're going to merge with SLAM. So I think I probably just ought to name that. Actually, our commitment is to the work of the South London Partnership and to continue to strengthen that work. So I hope that has sufficiently answered your question. Dear Jen can't be unmuted. Let's see if we can try one more time to unmute her. If not, I'll have a go at answering her question. Can we? Oh. No. So I will make a start. So I really appreciate the impact of, so her Teams has just crashed, so I'm going to just ignore that gently. So in terms of waiting times, you were right in the response that you gave, which is that our waiting times are very different for different types of services. What I can tell you is that we have no 52-week breaches. We monitor all of our waiting times in connection to, are you going to be able to come in, Jen? Can you unmute?
I think so. Can you hear me?
One. We can hear
yeah.
you. You look fabulous. Over to you.
Superb. Thank you. Sorry, Vanessa, had you started answering my question? Because I
gave it a go, but not as adequately as you. So you go for it.
I'll try. I'm Jen Allen. I'm the Chief Operating Officer. Hi, everyone. Yeah, so thank you for the questions, and sort of capacity of services, waiting times, and the resources and the staff that we need to meet that demand are issues of huge importance to us all, and absolutely key on our agenda. So really, really good questions coming in. We obviously we share information on our waiting times, both in terms of 52-week waits, 18-week waits, and more general, the wider kind of waiting times for different services ranging from crisis through to our elective services within our quality and performance report, which is published every month with the board papers. And we also publish a lot of information about our portfolio of services on our website. So we try and keep that up to date and give people a good perspective of the portfolio that we have on offer across the boroughs there. So I'd encourage people to take a look at that information, because we are very keen to be transparent around the kind of performance that we deliver and the waiting times that we experience. So we do have different waiting lists, obviously, for different services, as I think Councillor pointed out in your question. So we don't really have a sort of overall average wait. We've been successful in addressing some long waits in some areas, particularly in some of our children's neuro services, and we have no patients now waiting over 52 weeks, and we're bringing waiting times down in some of the areas of greatest pressure. We've seen a surge in demand for neurodevelopment services, for adult community services, as has been mentioned, and for psychological therapies, both in IAPT, increasing access to psychological therapies, and in our community teams. So we're very conscious of those pressures and continue to monitor them really closely. And we have quite a lot of improvement work in train to understand those waiting lists and how we can address people's needs as quickly as possible. Clearly, there's a demand and capacity element to this, and we work very proactively with our commissioner colleagues within South West London to try and put plans in place using the mental health investment monies available to increase capacity where we need to, where there's a mismatch with demand, either historically or since the pandemic has changed the picture slightly. And that's a really important piece of collaboration to make sure that we put the resources in the right places to address the waiting times. And then, as was rightly pointed out, we also need to use those resources and recruit the right staff with the right skills. And that is an ongoing challenge, as it is for the whole of the NHS. So we do have a challenging vacancy rate, and we're trying to bring in people at all different levels to support developing our workforce, bringing in people who we can train internally and encourage and support in their careers to deliver those services in all areas. Happy to say anything else, Anne, if you need more information.
Could you just pick up Kathy's point about where people can find information on our waiting lists? Did I miss that?
In the quality and performance report is the main source of the information within the published board papers. So we can give people information about waiting times, and we do include that within communications when patients are referred to our services. We try and communicate really proactively about what the likely waiting time is on an individual level, but in terms of general sort of average waiting times or the standards that we meet in terms of wait for services, that's within the Q&P report.
I think I've managed to unmute myself, which seems to be a bit of a sticky button. So thank you very much for that, Jen. Sorry about the difficulties you had getting in. So I'm pressing a little bit, but Malik has raised a question in the chat function, which I interpret about how do we support parts of our communities who are less able to co-produce with us, to make sure that we really are involving all elements of our communities. So Vanessa, are you going to take that?
Yeah, I was going to take that. So first of all, I want to say a big thank you to Malik and to the to the programme of work that he's led across our communities. Your energy is inspiring, Malik, and your commitment to doing this work. And you know that we're committed to doing this work alongside you. But I do think your point around funding is fundamental and about how we influence the funding to be used and directed in the right parts of the system. And that's why the work with the ICS that we're leading jointly together is going to be critical to this commitment. You heard me earlier say that I'm committed to taking decisive actions, and that remains the place. But I think it's about how we influence the whole system on their knowledge of health inequalities. So with you, Malik, I'm very happy to work to continue to do that. We'll also continue to look at the additional investment under the long-term plan and how we're going to use that money most effectively across our 5 boroughs.
Thank you for that, Vanessa. And I'm not sure, I'm trying to pick up, there's a few points in the chat from Annabelle about crisis services and trauma-informed services. Is that for you, or direct me to someone else in the team?
So I'll make a start on it, and then if anybody else wants to come in, they'll turn their cameras on. But what I would say is that Ian Petch, our head of psychology, has done a fantastic piece of work looking at trauma-informed care. Ian, I don't know whether we can unmute you. Probably, can you unmute yourself? You could perhaps then talk about our approach to trauma-informed. You can't unmute yourself. No, you're silenced. Apologies.
Unmute, Ian.
Thank you. Can you hear me now?
Yeah.
I am unmuted. Thanks, Vanessa. Annabelle, thank you for the question. So I was just replying to it in the chat. Yeah, we've got a programme of work around trauma-informed care. It's made up of a multidisciplinary team and includes people with lived experience of experiencing trauma and its impact on their mental health and well-being. We launched trauma-informed care training in April of this year. And I think it was in the first 3 or 4 months, we've trained 150 staff across all of the service lines from a range of disciplines. We reviewed the programme of work within our quality governance group yesterday and have a mandate to proceed with that work so that we can implement routine screening for exposure to trauma, the impact that that has on a person's mental health and well-being, irrespective of diagnosis, and we can make sure that that practice is standardised across all of our services. That's just scratching the surface, really. We've got a whole programme of work around trauma-informed care, and we are collaborating across London to embed trauma-informed care, in particular in our inpatient services and psychiatric intensive care units, where we often see people who use our services distressed as a result of traumatic experiences in the past. So yeah, I'm pleased to report, yes, we've got work well underway.
Thanks very much, Ian. Now, I've quickly scrolled the chat function and I can't spot, unless somebody wants to point out to me, I think we've covered most of the items in the chat. But as we said at the beginning, if we weren't able to do that, we will go through it and make sure that we've covered off all the points, and that we will post those with details of this meeting. So I think it's probably time for me to draw the meeting to a close. And I really want to do that by thanking you all for making time to come and spend with us this evening, and for all of the questions and for all your continued support of us throughout the year. It really is helpful to us for all of the support and the challenge that you bring to us. I want to really thank our keynote speakers, Dr. Bola Owolabi, Michael Wood, our community leaders, Tiff, Yvonne and Rachel, Amy, and all of the people on the video. I think that they've really enriched the conversation that we've had this evening. But I want really also, and I usually start the board meetings in this way, and I think it's probably right to close the annual members meeting to say a real thank you to all of our staff. I hope some of them are on this call. I never fail to be impressed by the dedication and commitment and care that they give every day to our patients and our service users. And I know that over the last 12 months, that has proved particularly difficult. So I absolutely want to thank you for everything that you do for us. You really do make a difference to the people for whom we care. So I hope you've enjoyed tonight's presentations. I hope you found it stimulating. I hope you will continue to involve yourselves with our trust and work with us to make people's lives better. Enjoy the rest of your evening, and thank you very much once again for joining us.
Thank you. Bye.
Thank you, Yvonne.
Bye. Bye. Thank you.
Thank you. Bye.